Welcome back. Hopefully you had a chance to take a bio break and get a refill on your water or your coffee or your tea. We are back here in session and very excited to welcome another panel for today, which will be moderated by one of our committee members, Dr. Iruka. And I'll turn it over to Dr. Iruka to introduce our panel and to moderate this discussion. Thank you.
All right, good morning. So we will now hear about, I should first say my name is Ioma Iruka, and we will now hear about different approaches to applying socio-behavioral and neurobiological sciences to promote healthy development and health equity during the prenatal and early child periods in this panel. First, we'll hear about the Early Childhood Innovation Network from Sarah Barclay Hoffman. Ms. Barclay Hoffman is the Assistant Director of the Early Childhood Innovation Network and a Program Manager with Children's National Health System here in Washington, D.C. The Early Child Innovation Network is a local collaborative of health and education providers, community-based organizations, researchers, and advocates promoting resilience in families and children from pregnancy through age 5.
Thank you so much. On behalf of the Early Childhood Innovation Network, I want to thank the committee for having me here today and for all of the preparations by the members and staff as we headed into today. The present moment is the only time over which we have dominion. Mindfulness is a practice and innovation that we are implementing with families, applying the principles of mindfulness to the very real challenges of parenting. We try to not only talk the talk, but walk the walk with the Early Childhood Innovation Network. So I'm just going to do something a little bit different and would like to invite you to join me for just a few brief moments to focus on perhaps an object in front of you or your breath. And again, this will just be very brief, but to be able to focus and come into what this present moment has to offer us. So I invite you to close your eyes and I will bring us back. Thank you so much. Our parents do more than that, but I calculated that took probably 6 or 7% of my time. So need to move on. Again, I'm privileged to be here today and presenting the collective efforts of many individuals who comprise the Early Childhood Innovation Network, or EASIN as we call it for short. However, I just want to take a brief moment to ground us in who is at the core and true center of this work. Women like Angel, who is participating in our mindful parenting innovation, who is featured here on her first ever visit to the Capitol to tell her story to lawmakers. Beautiful babies and toddlers like Angel's daughter sitting here in the halls of Congress. And might I add, I think this looks really great on her, so we might be voting her into this office in 30 or 40 years. And leaders like Joe Patterson and community members who gather on a regular basis to tell us their strengths, their struggles, and their solutions that will work if only we listen and co-create together. Easton is focused on 3 core goals for children and families. First, keeping parents well with a focus on mental health so they can be the best buffers for their children, building healthy brains and optimizing early childhood developmental outcomes. And 3, preparing children to learn so that they are ready in all meanings of that word for school at age 5. Easton started in 2016, so we are about 2.5 years into our journey, and we are guided by 4 key principles. We believe that our work needs to be grounded in science and multi-generational, again, so that all caregivers can be buffers for the children in their lives. Built on existing resources and enhancing existing organizations and their capacities. We cannot continue to be siloed. Our work has to be cross-sector. And again, our work really truly does need to be foundational and grounded in community voices and community experience. This graphic provides a framework for Easton's efforts of taking the scientific knowledge we have on early experiences and relationships and their impact on brain development and translating that into actions that will help us achieve those 3 goals that I spoke about. We believe there is a critical role for education and technical assistance and empowering child-serving and family-serving professionals with information on how we can build resilient children and families and the role of adverse childhood experiences, adversity, and toxic stress. I will go into further detail in the coming slides on our innovations in care and family support that are happening in the healthcare space, early learning space, community-based settings, and leveraging 21st century technology. An important strand is policy and systems transformation, taking what we are learning, what we are seeing is happening on the ground, both positively and where there is room for improvement, and using that to inform more systemic change. And again, this foundation of everything in the evaluation and research and this co-creation model with families and communities. We spent really the bulk of our first year embarking on significant research into models, the literature. We had conversations with local leaders, with national folks, some of you who are in this room we spoke with, community-based organizations, all of this to determine and help further focus what our innovations and partnerships would look like. And this is basically where we have landed in prenatal care, integrating mental health so that women can have that support during their prenatal visits. Implementing the National Healthy Steps model into pediatric primary care, however, based on conversations with patients and providers, we have innovated on this model. So we have a seasoned child psychologist, a family service associate who really helps with intensive care coordination and systems navigation, and a further focus on making sure we can connect children to early intervention and those needed developmental services. Within early childhood education, as I mentioned as we started off, we are implementing mindful parenting classes, implementing social emotional curriculums, and early childhood mental health consultation. In our place-based initiative, we are leveraging the power of peer support specialists who have deep knowledge of specific communities in Washington, D.C. to work with families who have young children age 0 to 5, connecting them to resources, providing social support, and providing educational information. We are also working to leverage the technology that, frankly, almost every parent and family has and developing out a mobile application that can connect parents to each other. We're finding that parental and social support, we know that's a protective factor, and that's something that families are really craving, and to further resources in their communities. I'm not going to go into super depth about this because we very eloquently heard about a lot of this in the last panel, but we are inspired by and using the Frontiers of Innovation model for developing our intervention strategies to improve outcomes and families. This does propose an extended development period where we are engaging in those rapid cycle evaluations to refine the theory of action, test measures, address implementation, and really, again, focusing on that co-creation where we're working with our families and community members to create these innovations. We were asked by the committee how we're taking into account subgroup differences. We are not yet at the place where we have that data to report that out, though I'm happy to provide some of the examples that we will be looking at. We are in the process of embedding that into our evaluation process, and all our pilots, we will be looking at those moderators. This slide just provides some brief context for some examples of themes that emerged out of qualitative interviews and conversations that were done initially to guide our intervention development. So I don't want folks to take too much from this because they were with small sample sizes, one or two sites. But again, I think really important that this formative work is done to work on creating those interventions. So for example, in the prenatal space, using this feedback from patients has guided how our mental health clinician engages with women, the language she uses. As I mentioned previously, in pediatric primary care, this feedback from both pediatric primary care providers and families that they serve guided how we enhance the Healthy Steps model for integrating parental mental health support. We're actually having brief therapy sessions for parents in pediatric primary care in response to what they wanted support on, and further focus on intensive care coordination and revamping referral systems so families can get better connected to the services that they and their children need. This just provides an overview of some of our preliminary findings. Within primary care, we are seeing significantly higher success rates of early intervention referrals when they are facilitated by the Healthy Steps team versus when they are facilitated solely by the pediatric primary care provider. Within early childhood mental health consultation, building on and extending previous work, that we are seeing positive effects in consultation in a public charter school system where we are implementing this that does serve high-risk populations with a high prevalence of child social, emotional, and behavioral needs. In our mindful parenting innovation, again, taking place in an early learning setting, we are seeing significant decreases in sleep disturbance in parents, parental distress, depressive symptoms in parents, and significant increases in parental support by participating in these small groups with a mindfulness practitioner. And broadly, we are beginning to see that our healthcare and education systems within which we are working are starting to change as a result of this. For example, with Healthy Steps in primary care, providers are collaborating more with mental health care providers at well-child visits. That's a change in practice, and expanding their capacity to address both child and parental mental health concerns. We are proud of what we have accomplished over the last 2.5 years, though we know there are many growth edges in the work that we are doing. As I was speaking with our Director of Research and Evaluation, she said, it will come to no surprise to many of those in the room that the IRB process often does not keep pace with this rapid cycle approach. One of our community leaders is continually reminding us, and it is important that she does, that we need to ensure we are getting accurate data when we are conducting our research and evaluation, and recognizing that there have been historical research abuses and exploitation, and that there still are issues of researchers coming into communities and, quite frankly, getting their research and leaving them high and dry. We, of course, are hoping and intending that we have a very different outcome, but that still has implications for how we are building that trust and working with our communities. And we also grapple with some issues of not all of the measures that we are using, for example, with the mindful parenting innovation having been normed and validated with the populations that we're working with. This co-creation process truly does take time. However, the development and dissemination processes are often quite sensitive, time sensitive, and that can create tensions and issues and able to really be able to do that work collaboratively. As we talked about, and I think heard before in the last panel, there are still very few grant mechanisms that support development of interventions that use this frontiers of innovation, rapid cycle, co-creation model. And sustainability, we are certainly seeing this. The innovations that we are piloting and the requisite research that accompanies them are filling a service void. For example, there is a reason why we are providing mental health services for parents in pediatric primary care, because there are other systems that are not working for them. But this is a challenge because if these innovations are working for families and they are feeling that this is integral to their health and well-being, their children's health and well-being, if they're not sustained and they come to an end when that research ends, where does that leave our children and families? We truly believe that everything we do within the Early Childhood Innovation Network also should be very much focused in advancing racial and health equity for all of our children, families, and society. One way we have started to address this is by forming what we call a Racial Equity Council. And they have developed a set of very robust objectives. I do not have time to go into all of them, but some of them include making sure that we have an intentional equity lens at every stage of growth of the network, and that we are really incorporating this into our day-to-day work in terms of all of the folks who are working on this initiative, that we are fostering organizational accountability and building equitable decision-making processes. It's comprised of folks from across the network and includes our 2 co-directors, and they meet on a regular basis. We're also very much seeing and trying to address some of the institutional and systemic practices which perpetuate inequity. One very real example that we have seen as we have gotten into this work are our, quite frankly, very lengthy and laborious subcontracting processes from some of our larger anchor institutions. And so when we work to engage smaller grassroots community-based organizations, it's frankly an egregious amount of time in many cases before all of that paperwork goes through and they get their funding. We have to address that. It's inequitable, it's not right, and we're not going to be able to make the progress that we need to make if we don't address those things. We're considering very, very strongly and really grappling with integrating equity into our evaluation approach, thinking of questions such as who interprets the data, who sees the data, and who interprets it before it goes to, for example, publication, who's on the manuscript, who is on the research team. So at this point, we may have more questions than answers, but we feel this is very critical, and it continues to be an evolution for us as we wrestle with how we find these approaches to address equity or to address in both the short and long term very real inequities while continuing to work in our institutions and systems and serve children and families. The committee noted we have a significant number of partnerships, which we are very proud about, and how we are able to build and sustain these partnerships and effectively have folks across sectors work together. Just at the center of this, I want to highlight one of our mindfulness practitioners recently said, we are really seeing healing happening in our communities with what we are doing, and it's happening across generations. And I really do believe that when you are truly partnering with families and communities engaged in this healing work, which happens in healthcare, community-based organizations, early learning, people see that, people feel that when it's true, and they want to be engaged in that and partner with that and do that for the long term. However, there are other critical lessons learned. Transparency is key. I'll give just one brief anecdote. One of our community-based organizations said, can we see your budget with the percentages of how everything is allocated for salaries, for interventions, for contracts? Those being able to do that early on, be transparent about all of that, really works to build the culture of trust. And change won't happen if we don't have that trust. In a similar way, Vice President Joe Biden has been quoted, "Don't tell me what you value, show me your budget, and I'll tell you what you value." I think historically and still in present day society and many institutions have valued certain types of expertise, medical expertise, legal expertise, research expertise. I'm not here to say that that is not important. It very much is. But I think we have undervalued in many cases community knowledge, community expertise in having lived experience, in being able to be a peer support to help someone else on their journey. And we are very much working to really value that in real dollars and cents in terms of how we allocate our money. Communication structures are important. That's a picture of our team meeting, and I know no one wants to say that they want to add more meetings to their schedule, but how we leverage meeting structures, technology, we have found is really critical, and that there are ways to bring folks together to work across sectors in a regular way to really be able to move that work forward. And having champions at our partner sites, we also believe is absolutely critical. True to our guiding principles, we are connecting to existing resources and existing organizations. In many cases, those are large institutions that have their own cultures, their own way of doing things. And we are disrupting that. And right, we are trying to disrupt the status quo. But we need to have folks internally who then can work to move that forward. And lastly, with regards to policy and systems transformation, we have been really fortunate here in DC to see a significant amount of momentum around early childhood. Our DC Council recently passed a significant bill focused on birth to 3, both health and education sectors included in that. It has expansions for Healthy Steps, home visiting, early childhood mental health consultation, has an equity lens. So we're also thinking about those that need access to these the most, works for quality and improved access for childcare. We've seen philanthropy really playing a significant role in this, and also seeing folks really galvanizing beyond the sectors of health and education. For example, our Attorney General here in DC is a huge and vocal proponent of the birth to 3 and birth to 5 space, and is very much engaged in what we can do on the prevention, early intervention side to disrupt school to prison pipeline and crime and violence in the community. We'd love to see a creation of a continuum of resources, this enhanced care and support from prenatal to pediatric and then into early learning. And just very briefly, 2 pieces when we're thinking about the sustainability and scaling of the workforce. What does this look like in terms of, as we scale this, our current workforce, particularly for mental health professionals in early childhood mental health, for example, if we're scaling early childhood mental health consultation, making sure we're not taking from those who can also do work on the treatment end to, do the prevention work. So looking at that full scale. And in terms of workforce development, how can we think about this work to also develop skills and certifications for parents and caregivers so they can have the means and access to more sustainable and living wage jobs? So thank you so much. Oh, and our funders.
Thank you.